Welcome to my lecture. Today we are going to discuss second part of the carpal bones. So let's start. In the previous lecture we discussed the general properties of the carpal bones, or you can say wrist. So in this lecture we will discuss the specific points of each carpal bone. So as we know that there are basically 8 carpal bones in our wrist. So we discussed that the carpal bones are arranged in two rows, proximal and the distal. In each row, proximal and distal row, you will see the 4 bones. So first of all, we will discuss the proximal row of the carpal bones. So in this, you will see the 4 bones: scaphoid, lunate, triquetral, and pisiform. Okay. So if we discuss first of all scaphoid. Scaphoid means board shape. Okay, if you see here, like as we know that this is the lateral aspect and this is the medial aspects of the hand. Okay, and if you see here, like here is the radius bone and here is the ulna. That is another important point. Okay, and that is actually the side at which you will see the thumb. This is actually the thumb side. This is actually thumb. Okay, and as you know that first second row. Okay, first bone is the scaphoid bone, right? That is actually present at the lateral side. So if you see, like scaphoid, important features of the scaphoid is that it has a tubercle. So if you see here, like it is actually a projection, and that projection is actually a tubercle. Tubercle is actually present at the lateral side of the scaphoid bone. This is important features of the scaphoid, and it is actually move forward, downward direction. So it is actually move forward and downward direction, and it is actually present at the lateral aspects. So this is another important point. Okay, lateral aspects. And next we will discuss this scaphoid bone will attach to how many bones. So if you see here, if you make the mnemonics, that mnemonics is the TLCCR. Okay, what does it mean? It means that if you see here, like scaphoid bone is surrounded by different bones. So it's mean that the scaphoid bone will attach to the trapezium bone. Okay, it will also attach to the trapezoid bone. Trapezium, trapezoid. TT, trapezium, trapezoid. Okay. And next, L stand for lunate, C stand for capitate, and R for radius, like here. So it's mean that it is surrounded by the overall 1, 2, 3, 4, 5 bones, and it actually form articulate with all these 5 bones. So this is an important feature, and that will help you in remembering that this scaphoid is attached to different bone and what bones, and that will help TTLCR will help you in remembering the scaphoid bone is attached with different bones and what types of bone. Okay. Next is the bone is the lunate. That is actually the half moon shape, or you can say crescent shape bone in the wrist. So if you see, next is the lunate bone. Okay, actually it is actually lunate. I'm saying lunate. If you see here, like this bone, here is the situation. At one side it is actually a crescent shape or half moon shape, like this one, at the level of the scaphoid bone. So this is important point. At the scaphoid bone side, you will see it is actually a crescent shape, or you can say half moon like. This is an important feature. Okay, but at the level of next bone, and next bone is the triquetral bone, and at the level of the at the side of the triquetral bone, you will see the shape of the lunate bone is quadrilateral. So this is another important point. At the triquetral side, you will see the shape will be quadrilateral. So that's basically the two important points. So semilunar at the side of scaphoid and quadrilateral at the side of the triquetral bone. So these are basically the two important features. And lunate is attached to different bones as you see, and that you will remember by the RCSHT. Okay. R means, if you see here, R is basically the radius bone. Okay, lunate will attach to the radius bone. C for capitate. Okay. S for scaphoid. H for hamate bone. And T for triquetral. So it means 1, 2, 3, 4, 5. Again, 5 bone is surrounded by the lunate bone. Okay. Next is the triquetral, means 3 corners, or you can say pyramidal shape. And if you see, next bone is the triquetral. It is actually 3 corners, or you can say pyramidal in shape. Okay. Important features of the triquetral is that it form a facet. It form a facet, oval facet. So it form a oval facet. Facet means surface for the attachment of what bone? Pisiform bone. So actually triquetral is attached with the pisiform bone. So this is actually the, it will attach to the pisiform bone. Okay. But the important feature is that the oval facet is present at the distal side of the triquetral. This is another important point. It is actually present at the distal side. Okay. Now if you see, like, this is the proximal and this is the distal aspects of the triquetral, but the pisiform bone is actually present at the distal aspects of the triquetral bone. Okay. And if you see here, and that is actually the palmar aspect. The whole structure is palmar, palm side. Okay. And this is another important point. This is actually present at the palmar aspects. Okay. These are basically the important feature. And what bones will actually attach? So if you will remember it by the ALP-H. So if you see, like A stand for articular disc. Here basically that disc, that is actually the ulna, that is actually for the ulna and the radius. So that disc is actually attached with the triquetral. This is one case. Next is the L. L for lunate. Lunate will also attach to the triquetral. Okay. P for pisiform, that is also, and H for hamate bone. So these are basically the different bone. Next is the pisiform bone, and this is very simple. Pisiform also has oval facet. So oval facet, okay, and that is for the triquetral. It means that the triquetral and pisiform has both oval facet for each other. So you will see this is for the triquetral, okay, and but the basic difference, it is actually present at the distal side of the triquetral, but in the pisiform it is actually present at the proximal aspect of the pisiform. Okay. Now this is the basic difference between these two bones. Okay. Next, if we move forward towards the distal row, and that is actually the distal row. Okay. In which you will see the 4 bones like the trapezium, trapezoid, capitate, and last is the hamate. Okay. First one is the trapezium bone, that is actually quadrangular in shape. Okay. And in that situation, here is the trapezium bone. Okay. Trapezium bone has crust and groove anteriorly. So if you see, like, this is the anterior aspects of the trapezium bone, and this is the posterior aspects of the trapezium bone. But at the anterior aspect, you will see the crust and groove, like this one. Groove like structure here, like this is the groove. Okay. And that will form the joint with the metacarpal. Actually, here are basically the different carpal bones, and here is the metacarpal. So if you see, like, this is the first metacarpal that is actually present at the thumb side. This is the if you see here, like this one is the second, this is the third, this one, this is the fourth metacarpal, and this is the fifth metacarpal. So first, second, third, fourth, fifth, 5 metacarpal bones. Okay. Actually, trapezial bone will form a joint. What type of joint? Cellular joint. Okay. Cellular joint form between the trapezium and the first metacarpal bone. And it is actually, trapezium is actually support our thumb. So thumb is actually supported by what bone? Trapezium bone. Okay. And other important feature at the, actually this is the palmar aspect. At the palmar aspects, you will see a groove. And you will see, and that groove you will see, that is very much important for the attachment of the flexor carpi radialis. So tendons of the flexor carpi radialis. So actually it is actually along the radius bone. So that's why I called it flexor carpi radialis. Okay. And the important bones that will attach to the trapezium, you will remember it by the ST12. What does it mean? It means S for scaphoid, T for trapezoid. Okay. And 1-2 means first, it means that the first metacarpal and the second both will attach to the trapezium bone. Okay. Next is the trapezoid, that is baby shoe like structure. Actually in that situation it will look like this. It is actually, it has small surface at the proximal end, but it has larger surface at the distal end. So it will actually look like the baby shoe. Okay. And in that situation, important feature is that at the distal side you will see the larger surface, at the proximal side you will see the surface will be smaller. Okay, that is the trapezoid bone. And what bone will actually attach to this? STC2. What does it mean? S for scaphoid, T for trapezium, and C for capitate, and 2 for second metacarpal will also attach. So actually trapezoid is surrounded by 1, 2, 3, 4. So it will articulate with all these bones. So next is the capitate. Capitate means head. Okay, why do we call that the capitate has head? So if you see like clearly that at the proximal aspects you will see the clear head. Okay, and that will goes towards the laterally. Okay, and that is actually the capitate bone. And capitate bone will attach to the different bones as well. Like you will remember it by the STLH234. So S for scaphoid will also attach or articulate with the capitate. T for trapezoid. It just think about, T doesn't mean that the trapezium. Trapezium is actually far away from the capitate. So we consider this T as the trapezoid because trapezoid is just near to the capitate. That's why we can consider T in this mnemonic will be the trapezoid, not the trapezium. So this is another important point. So T for trapezoid. Okay. L for lunate. Lunate is actually near to the capitate. And H for hamate. So these are basically. And last is the 2, 3, 4 is the metacarpal. So if you see second, third and fourth metacarpal will attach to this one. And specifically, if I speak specifically that the fourth metacarpal is attached with the special facet of the capitate bone. Okay. Next is the hamate bone. Okay. Hamate means hook-like. Actually, it is a wedge shape structure. Wedge shape, or if you see here, like every carpal bone has 6 surfaces, and it is actually wedge shape. And in wedge shape, you will see the hook-like structure. So if you see, like there is a hook-like structure. If I say like this is the bone, and this bone has a hook-like structure in it. Okay, in this case you will see again different bones will attach, and that will be the TLC45. T for, that is triquetral, okay, L lunate, and C for capitate, because these are just near to the hamate bone. Okay, and again keep remember that there will be no articular side at the medial aspect in this case. Okay, and next if you see, fourth and the fifth metacarpal will also attach to the hamate bone. So this is all about the carpal bones and different attachments of the carpal bones. If you have any question, you may ask in the comment section. Thank you so much.